Welcome to the Taking Care of Tutu podcast. I'm excited. This week, our guests are Teana Kahoohanohano. She's the administrator at Hale Makua Health Services, and Alohi Gomes, who's the director of social services. So, tell us why you work at Hale Makua.
Go ahead, boss. I can go first.
Because I remember, Teana, with you, you weren't even living on Maui at the time. So it was like a pretty big deal for you to come work at Hale Makua. It wasn't something I think you undertook lightly.
No, not at all. I have been a nursing administrator now for 16 years. And when I got into nursing home care, was never a field I wanted to get into initially. I thought out of college I was going to go to hospital operations. And then the position just kind of fell into my lap as a administrator in training, and I loved it. But getting back home, I worked in the mainland, so getting back home took some years.
Yeah.
And Hale Makua, eventually opened up this position after the previous CEO retired after 40 years. So it was for me a coming home for sure. I always felt like I was servicing other communities in all the work that I did, but not servicing the community that raised me. So it was truly a homecoming for me to come here and serve our kūpuna in Maui.
Great. And then Alohi, how long have you worked at Hale Makua?
I am in March, I'll make 3 years, so I'm coming up on my 3rd year, really exciting. Very similar, not necessarily coming home because I was already home, but really taking a step back and going, I'm dealing with a lot of young people and children, and I want to start kind of pivoting my career to how do I support those who supported me and supported the growth of Maui, and just that aging population. Um, and that's kind of why I was like, you know what, I think I'm okay leaving my job as a social worker for children and youth, and I really want to pivot for that kupuna age range.
So tell us a little bit about Hale Makua has so many different parts to it, but can you give us an overview of what you folks do, what Hale Makua provides, what services?
Absolutely. At the core, Hale Makua is a skilled nursing long-term care facility. So we provide skilled nursing, which means residents who come out of the hospital that need short-term rehab. So physical therapy, occupational therapy, speech therapy, wound care, IV antibiotics, to name a few. So they'll be with us normally for 20 to 28 days on average. And we also provide long-term care services where we are their home. They live with us. Their families no longer have the capabilities to care for them for various reasons, financial, physical limitations, housing limitations, all kinds of reasons. So we have locations for skilled nursing and long-term care in Kahului, which is where Alohi and I are. We also have a Wailuku facility that has beds there. Our Wailuku facility also has a care home, which is a lower level of care. Some of those residents can do some things for themselves, like bathe themselves, monitor their medications, feed themselves, those kinds of things. For the most part, they aren't in wheelchairs. They can walk around. Um, and then Kahului has adult day health, adult day health, which they can come to us during the day, Monday through Friday, 7 to 4. And we have just activities and socialization for them. A lot of our adult day health participants were here for short-term rehab, and then they just loved it and go home and they want to come back every day, just so they're not home and bored alone. And it helps with safety for their loved ones, so they know they're being watched during the day. Someone watches them. Um, we also have home health services. So if they're discharged to the community, we can provide physical therapy, occupational therapy, speech therapy, wound care in the home for continuation. So they're not really at the level where they need 24-hour care, but someone can provide those services 2 to 3 times a week in the home. We also recently opened our Kalele program, and Kalele is a healthcare navigation program that starts when they enter here, works closely with our social services team, and they really help navigate the residents once they discharge to the community to ensure their home is set up. The grab bars in the showers, in the bathroom, toilet, those kinds of things are set up. They can do home assessments to see what the needs are. They also ensure once they go home, they go to their follow-up doctor's appointments because, that's always a concern, right? We have all these appointments set up for follow-up care, and sometimes if they live alone, they forget. Then they end up back in the hospital. So Kalele helps ensure they're calling them, hey, did you go to your doctor? Do you have transport? How can I help? Because the goal really is to keep them home in their own home, right? Where they feel safe and secure and they can age in place.
So your team, Alohi, is when someone is being discharged, you're looking at their insurance, figuring out what their needs are. Is that sort of what you're doing for discharge?
Yes. So discharge planning starts the day you get here. And sometimes that's super stressful for families because it's like,
Yeah.
I just broke my hip. Why do I care about what my stairs at home look like? And it's like,
Yeah.
we need to know those things so that we can
Yeah.
better game plan services here.
Yeah.
And so that's our role, is just making sure that, you know, you do have steps and that we're actually being truthful with our, rehab facility and telling the therapist that you do have, steps, and you do have a tub and all these other things that they're not important because I'm not at home right now. I'm here at
But they
Hollywood.
are because you
But they
need to
are.
start having someone build whatever, needs fixing so you can be safe when
A
you get
ramp
home.
takes a while to build,
Yeah.
so let's start building it
You
now.
just throw that on the day you get home.
Which is,
Okay.
a lot of the time it's just navigating that conversation with the families and saying, "Hey, you have a friend in me. Let's figure it out."
Mhm.
We're gonna be the navigator while you're here at Hale Makua, and it's hard for my team because while we're assuming that role of supporting the family, we're also assuming the role of supporting the resident and their transition being here at Hale Makua now, because it's night and day to home, it's night and day to the hospital. It's its own entity that it's hard. This is your first injury, or maybe it's not, and this is your 10th injury, and you just continue to get better and go home. But that does take a toll on, like, your mental health. So my team also helps manage that transition while you're here.
What about like what do you do for fall safety during the day or also at night too?
Good question. A big misconception we get a lot is where are the side rails? So our beds don't have side rails like the hospital. The hospital has the full rails, right?
Yeah.
So CMS for long-term care considers a rail a restraint, that we are physically restraining somebody to get out of bed. And families freak out on us a lot when they come here. They're like, I want full rails. We don't even have them in the building on island. It's not something we provide anymore.
Wow.
So if someone is a fall risk, we try to know ahead of time. We put them as close to the nurse station as possible. We put alarms on the bed if needed, frequent checking, frequent rounding. We put like a mat next to the bed so it prevent injury in case they do fall. The beds can go all the way to the ground, like a huggy, basically, like very low to the ground.
Yeah.
But we can't. We always tell family we can't 100. I can't 100% guarantee that I can prevent a fall from happening. Unfortunately, we don't. As much as we try everything, sometimes our residents, they forget or they don't want to ask for help and they want to be independent. They want to do
Yeah.
their own, or they're like, oh, I walked with PT today, so now I can walk. We're like, no, you can't
Yeah.
walk alone. So
But you're always trying to strike that balance between independence and safety.
yeah,
Mhm.
absolutely. And it can be, it's scary for us for sure. It's scary for families and someone falls and has an injury. It's not ideal, but we try our best to ensure, frequent checking, monitors, alarms, those kinds of things, just in case. But good question. That the rails are a huge concern when they come to our building because they
Yeah,
think
and that's really
someone
interesting.
can.
You're saying, did you say what was the organization that referred to
Oh,
as a restraint?
CMS, Centers for
Yeah.
Medicare and Medicaid Services, that there are governing boards, so they license us to operate. And if we have a resident with a rail, they consider that a restraint.
So that has to be part of that would have had to have been part of that residence treatment plan.
Absolutely, prior to, and we can't, we in all of our years, haven't been able to justify someone who truly needs it.
Wow.
Yeah, so we have smaller rails, like you get a bed with a smaller rail that we've got an assist rail that a resident can use to like get out of bed, turn around.
I see.
those kinds
Yeah.
of things. You said you'll never get a rail to like lock someone in there.